all of those that are streaming online. We are very glad to have you joining us today. So, the North Jersey Alumni Chapter is marking World AIDS Day here at Sankofa Cafe, which is owned by our very own soror, Jessica True. So, we want to extend a very special thank you for allowing us to use this beautiful space to have this program. So, World AIDS Day is a day of solidarity for people who have been affected by HIV. It's a time for voices to unite and sharing experiences and telling stories and remembering lost loved ones and fighting against HIV. This year, the theme is collective action, sustain and accelerate HIV progress. My name, is Angela Gordon Thomas. I am the chair of the International Awareness and Involvement Committee for the North Jersey chapter of North Jersey Alumni chapter, of Delta Sigma Theta Sorority Incorporated, and I'll be your moderator this afternoon for this panel. And so this panel we will be discussing women of color, HIV, access to prevention medication, and advocacy. So we have a dynamic panel here for you guys, a distinguished panel. And I'll run through their information really quickly so you get to know them as well as I do. All right? So starting in no particular order, we have Alex Flores. He is the Regional Prevention Program Manager at Hyacinth AIDS Foundation, which is New Jersey's largest and first HIV service provider. Mr. Flores oversees harm reduction, PrEP, and the She PrEP initiatives. With a wealth of knowledge and over a decade of experience in this field, his journey has been guided by a deep empathy and genuine passion for his work. This dedication has shaped his professional path and reassured his competence as a leader in managing various programs effectively. Hyacinth Foundation first opened its doors in 1985 with the mission to help people dying from HIV/AIDS. Today, with advances in medical treatment and what scientists know about HIV, they're helping clients live full, healthy, and productive lives. Their mission is to help people live with HIV, stop the spread of the epidemic, and serve as a critical voice in the public debate surrounding AIDS in New Jersey. Their goals remain the same: to help each individual living with HIV develop the mental and physical strength to live with the disease, to manage their sexual health, live life safely with partners, and maintain a treatment regimen that works most successfully for them. Hyacinth Foundation has 8 offices in 7 cities: Jersey City, Paterson, Plainfield, Trenton, New Brunswick, Newark, and West New York. Our second panelist is joining us from Dallas. Her name is Sadie Zapata Nashawaya. She is a state policy manager with AIDS United, and she considers herself a community weaver and activist. Ms. Nashawaya believes in building and creating new leaders in marginalized communities with advocacy and storytelling. She started her work in the HIV movement in 2018, working at a community pharmacy focusing on medication assistance for people living with and vulnerable to HIV and supporting the 340B program. She later transitioned into the nonprofit sector, educating and explaining advocacy fundamentals and the Texas legislative framework, mastering outreach, partnerships, and engagement. Outside of work, she's passionate about reproductive justice, Black women, and LGBTQ voices, as she sits as the Secretary of Board of Directors at the Afia Center in Dallas, Texas. She is the winner of the 2022 DCEO Outstanding Healthcare Advocate Award and alumnus of the New Leaders Council in Austin. She is the co-founder and co-chair of Dallas's first BIPOC-led reproductive march. She's in Dallas and completing her master's in public administration, and she is determined to foster a better, stronger community with intentionality. This means educating the Congress about HIV, budget and appropriations and advocacy, integrating HIV prevention, care, and treatment into healthcare, strengthening the Ryan White program, investing in evidence-based prevention strategies, greater diversity and inclusiveness, pushing the President's administration to prioritize HIV, secure housing for everyone living with and vulnerable to HIV, and adopting a harm reduction approach while ensuring meaningful involvement of people living with HIV at all levels. And lastly, advocating for policy tactics to address the social determinants of health. And last but not least, we have Dr. Judith Francis. So with over 25 years of dedicated experience in health education, Dr. Francis has made a significant impact in advancing wellness and health equity across diverse communities. Dr. Francis's previous work included working as a community health educator at Holy Redeemer Home Care in Elizabeth, New Jersey, where she designed and delivered evidence-based prevention and wellness programs for schools, senior housing facilities, houses of worship, and community groups in Union and Essex counties. Her passion for community health led her to serve as program director for New Jersey Division of Churches Organized to Stop Tobacco and Save Tomorrow, a church-based initiative aimed at supporting faith communities and establishing health and wellness ministries. Under her leadership, the program focused on preventing youth tobacco use and promoting holistic health within congregations. Currently, Dr. Francis is a program manager overseeing the Healthy Women, Healthy Families program in Middlesex, Somerset, Mercer, and Hunterdon counties. In this role, she addresses critical maternal and child health issues and provides support for pregnant and postpartum mothers and their families. Her unwavering commitment to health equity drives her efforts to amplify the voices of underserved populations. Dr. Francis also serves as adjunct professor at William Patterson University in Wayne, New Jersey, where she has taught public health courses for over 15 years. She takes pride in inspiring the next generation of public health professionals by fostering their understanding of health and wellness. As a lifelong learner, Dr. Francis earned her Doctor of Education degree in Educational Technology Leadership from New Jersey City University. She plans to develop innovative digital curricula to enhance public health pedagogy through an action research design. Additionally, she envisions establishing a health and wellness practice focused on integrating mental and physical wellness. Dr. Francis is an active and proud member of Delta Sigma Theta Sorority Incorporated. With 37 years of sisterhood and service, she's affiliated with North Jersey Alumni Chapter, where she serves as one of the chairs for Physical and Mental Health Committee. Thanks, in the professional arena, she has also served as treasurer and past president of the North Jersey Society of Public Health Education. Distinguished panel. So, I'm gonna take a breath really quick, and then I'm gonna jump to All right, so guys, I'm very excited to have you here. You already know that, I've told you multiple times. So let's just start with some general information. So we know that World AIDS Day started in 1988, so we're in the year 36. World AIDS Day, but Hyacinth Foundation actually was established in 1985, so about 40 years we're coming up on. So are there any key misconceptions and myths surrounding HIV transmission that still persist today? I'll start with you, Alex.
I took a couple of notes on the questions because I don't want to miss any, right? Because there's a lot of misconceptions. And the kissing, right? For example, there's a misconception that kissing someone with HIV that's infected with HIV, they can get infected, right? Using the same spoon, hugging in the bathroom as well. So there's a lot of misconceptions. A lot of people have the mentality of the 80s, right? And not having the education that we have now, right?
Dr. Francis, is
I would like to add to that. Actually, I do have a visual.
it's our educator.
Yes. And if I don't know how many people have already seen this picture. Okay. Take a look at this. What do you see?
Man with the beard.
Man with the beard. Okay. Man with the beard. What about this? way, and then you look at it another way. So when we talk about some misconceptions with HIV/AIDS, you know, a lot of the misconceptions deal with misconceptions. And a lot of people feel that HIV is eradicated because certain celebrities may look a certain way or don't exemplify what happened back in the 80s. Because what used to be a death sentence is now a life sentence. And that HIV does not always convert to AIDS. And you don't have to have $1 million to get medical treatment, which we'll probably talk about within this forum. But people are not aware of how to contract the virus still. And it's not so much unprotected sex, which is a great big factor, but it's also our medical facilities, making sure they're clean, making sure when you go to a lab that the needles are clean, making sure it's a sterile environment, making sure even when you get tattoos that the equipment is being sterilized. So a lot of that is missed when we talk about misconceptions.
So I'm going to throw this over to you, Sadie. Thank you for joining us from Dallas. On that way, how can we address the stigma associated with both within healthcare settings and just the broader community?
I think a lot of it has to do, I think it's kind of what the other panelists said is that misconceptions are very correlated and interconnected with misinformation. A lot of, particularly in the Black and Brown communities, is that there is a lot of, you were taught with whatever your auntie, whatever your grandma, whatever in your family was taught. And so I think that how we were able to really address the stigma is one, just sitting with being uncomfortable. A lot of times being like a organizer, the hardest part is getting people to kind of sit with that uncomfortability. So like, I remember whenever I was a younger advocate and I was trying to have conversations with folks who weren't particularly in the HIV community and didn't know anything about HIV, the first thing they told me was like, "Are you living with HIV? Because you are having this conversation. I feel like I don't understand why you would even want to be involved." And so I think like I found out later that it wasn't just that they didn't understand information. It was the fact of being uncomfortable and talking about having these informations. And so stigma really comes from fear and being uncomfortable. And I think the only way that we're going to be able to address that, because I don't know if stigma will ever go away. I think it's something that we continuously have to combat as we go on because the world changes. But I think that we can push those issues by really sitting with being uncomfortable and sitting with acknowledging that fear and then really kind of dissecting that fear once we have acknowledged it, if that makes sense.
Oh, that's perfect. That's great. That's great. So when we're thinking about the train of thought with stigma and just the community, right? What are the latest advancements? And what are the latest advancements in HIV treatment, right? And how do they impact the lives of people living with HIV? Start with you.
Well, one of the latest advancements has been the injectable, right? With HIV, and also there's another injectable. The injectable is they have two injectables. One for prevention, which is the PrEP, which is called the Acritube, and that one you take every 2 months, right? And we also have the Capinuva, which is for people that are newly diagnosed. They don't like to take the pills, or that it's hard for them to remember when to take the pills, right? Or for the homeless, right, that don't have a place to store their medication, or even for the people that are married, heterosexuals that don't want their wives to see the pills, right, or to see the bottle. So the injectable is really important for people that don't have the sense of urgency of care, right? At least we know that they're on track by taking the injectable, right, every 2 months, and also they're in care if they're capital. So that's one of the advancements.
So when we talk about PrEP, right, let's take a little bit deeper.
Sure.
So I've seen the commercials. I don't know if you guys have seen the commercials, but I'm a few PrEP. you see Discovery, you see Doxy Pep. What's the difference between all of these? Is there a difference?
Yeah, there is a difference. The Doxy practice basically prevents STIs, right?
Okay.
So syphilis, gonorrhea, chlamydia, right? And as to PrEP, it only prevents the HIV. Totally different.
Yeah. Okay. So PrEP. So one of the things I do want to touch on in this conversation is PrEP was approved by the FDA a decade ago, right? But
2012.
well, more than a decade now at this point. So the thing to understand is, let's just focus on one group. The thing to understand, let's focus on one group. For cisgendered women, so that's women who were assigned female at birth and identified as a woman. They have, for all of the women cisgendered, Black women have the highest rate of infection for HIV, but they're the least likely to be prescribed PrEP, right? So there's a disparity that exists, right? So I want to know what the barriers are, right, for women in minority communities, because it's Black and brown women in minority communities, and what do they face when it comes to getting preventative medication or even being prescribed it by their medical professionals, and what can be done to improve those who need access to it. I'll start with you, Dr. Francis, and I'll throw it over to you, Sadie, and then you can bring it out.
There are numerous barriers when we talk about Black women. And they're also a mispopulation because they feel that, historically, from clinical trials, we've been missed. We've been misdiagnosed. We've been misrepresented. We've been unseen and unheard for so many years. One of the biggest barriers when we talk about treatment is also mental health. A lot of times, even with Black women dealing with just being women and then being Black and all things that come with that, the stress, the stigmatism, the anxiety, the depression. How do you deal with all that and still have to manage work, families, and everything else? So a lot of those things get missed, and even within the person, they may not seek those treatments because of stigmas and also emotional distress and lack of emotional support to even follow up or follow through.
Okay, I think it cut out, but I'm back in. I will. Okay. No. Okay.
Good. All right, well, good, Sadie.
Okay. Can you hear me now? Yeah. Okay. Perfect. I will go along with Dr. Francis on this one. So I'm 35, and I also have had a partner in the past who was living with HIV, and I took PrEP. Had took PrEP for a while, and so one of the experiences, along with what Dr. Francis said, is not only is there such a mental health issue with it, but there's also this idea of competing priorities that goes along with it. You know, not only did I have to worry about having enough energy and emotional support to be able to access care, but a lot of times is that not understanding your sexuality and understanding how comfortable it is just to go to the doctor as a young person in general. I almost had to decide which is the lesser of two evils. So a lot of times I was in a situation where I had a doctor who was not fully aware of how to access services with me. Like even getting an HIV test was very difficult for me. And so the only reason why I accessed PrEP is because I had seen it out in the community and asked. But even when I talked to my doctor at that time, there was a struggle because that stigma is still there of misinformation. And so I think that a lot of times that not only is it just mistrust, but there is an association with risky behavior that almost correlates interconnection with not being able to access, that I think oftentimes younger women experience. And then the reality is that a lot of us accessing healthcare is a lot if we don't have money, because we all don't have insurance. We all don't know how to get access to it. And in the community, a lot of the way that things have been marketed or tailored and designed is for people who don't look like me. And so I remember going into a doctor's office to get an HIV test, and there was no pamphlets that had Black women. There was no pamphlets that said anything about women, period. The front desk, not just the doctor, but the front desk clerk, the nurses, the MAs, none of them knew what to do with me. They all were confused. And so I ended up walking out of there, not even taking the prep, but 3 days later, after I had to go back into my refuge place where there were other women that were accessing services before I even actually took the medication. So when we're talking about like making sure that mental health is there, we also have to talk about the barriers that it comes into actual healthcare. It's not just the doctor, it's the front desk. It's what is being presented in the front door. It is the folks that are assisting the doctor who we really have to make sure are understanding to it. Because for Black women, if we don't see anybody that looks like us, we are not acting it. If Grandma Sharon and Aunt Susie said that we aren't, it's not okay, we're not going in there. If our friends didn't go in there, we're not going in there.
Absolutely, it's representation, right? And again, I can't stress it enough. For all of the different groups, people of color are affected and hit hardest by HIV infections, but we don't have access to the medication, right? So that's very important what you said. And Alex, I'm gonna drop it over to you.
It also goes with discrimination, right? I don't want to be discriminated. You go to these offices, and what you say about PrEP, they give you the look. The body language says a lot. And if you express some type of body language, the person will shut down, right? And don't even want to go, don't even want to go and speak about it because they fear of being discriminated against. Because all right, here we are, we're asking for PrEP. Now they're judging because they're thinking that you're out there sleeping with everyone, right? Just because of the PrEP, right? Because that's what a lot of people have the conception that it is a pill for people to just go out there and have sex with. Right? And it's a pill just to prevent, right? So it's discrimination with a lot, play a lot.
And I'll just add to that that also, as Alex mentioned about discrimination, social injustices, racial biases, implicit biases also exist. People make their personal judgment based on what they hear, and sometimes what they see, and not necessarily what they know. So we really have to get those messages out.
Speaking about getting messages out, right? So, Sadie, in your bio, I mentioned 340B, right? And you are a health educator. So, my question is, how can we effectively educate the public about science, the science of HIV, and its prevention? So, throw it to Sadie, you first. You can tell us about 340B. I don't know if anybody here or anybody on the live stream is aware of what 340B is, but Sadie, I'd like for you to educate us on that, and then Dr. Francis, actually I'll jump to Alex, and then you, Dr. Francis, to talk about prevention. Yes.
Sure. So 340B is so complex, but I'll try to break it down as best I can. So 340B is a drug pricing program that's a federal program in the United States that was basically kind of designed for eligible healthcare organizations to purchase medication at significantly reduced prices. So back in 1992, the program kind of helped safety net providers kind of stretch their resources and allowed them to kind of access medication for vulnerable populations. So entities, which they would call in the 340B access, would be like hospitals, community health centers, if it is a Ryan White program within a family planning clinic, and other types of spaces similar that are technically viewed as safety net providers. They're able to basically buy these medications from pharmaceutical manufacturers and sell these drugs at a discounted price. So sometimes they could be 20% off to almost 50% off of what the typical market price was. And I think the way to kind of break it down is that by buying these medications at a discounted price. So if it is, so for instance, we're talking about HIV, providing these medications, they receive reimbursement back, and then the organization itself can use that amount, that money that they receive, they're able to use that and put it back into their program. So when you see nonprofit organizations or community-based organizations that are able to provide housing vouchers, or they're able to provide bus passes, that is money that was taken from buying those drugs at a discounted price. And so that program is able to continue to provide to help them with that.
Awesome. That was a great explanation for something that's so multi-layered, right? For the money. But thank you for breaking that down. Alex, I do, so you're a program manager, we manage several programs, but I do want to focus in on one, Sheep Rep. And maybe you can explain how that helps to educate us in the community.
Sheep just got launched in November, so it's fairly new. We've been doing promoting. I do have the prep counselor. She couldn't make it today because she's on military drill. But
Thank you for our service.
but yeah, she has been working on creating focus groups in different regions, and it's not even a month, so it's just new to the program. So we'll be able to have more information in the next couple of months.
All right. Do you want to tell us about your prep education?
Prep education of what we do. I have 4 counselors, and they also do groups in their offices. They do band groups. They do focus groups, and they talk about stigma, disclosing, and they do a lot of outreach. They do tabling, gyms, libraries, and all the places that we may be able to grab right? We also have mobile units. We have 2 mobile units that we go out and we do testing in different regions, different parks. So we do a lot of promoting that.
Yeah, so it's boots to the ground. So we're
Yes.
actually getting out there and doing the work. I was doing a little bit of backup on Sheep Prep, and it's very new to your point.
Yes.
And it's sexual health equity, right? So it's really looking at getting prep to those groups, cisgender women, who don't have access to it. And HIV transmission is not just sexual, it can be through drug use, right? So it's like getting out there and educating the population about what they have access to. So very new, but we'll definitely have more information once we get it. We'll put it up onto our website so you can learn more about it. Dr. Francis, do you want to tell us about prevention methods?
Well, prevention is like the stronghold for public health. So primary, secondary, tertiary. And I think that when we talk about HIV, AIDS, education, we gotta go back to the basics. Just like in COVID, who would have thought hand washing would be the stronghold for that? Something that we already had, the equipment we already had, the resources we already had. So getting back to that knowledge base, and now that we're in a technology era, using all our education platforms, whether it's Snapchat, TikTok, Instagram, Facebook, YouTube, getting those messages out, using infographics, even animation to get it out, even some of the traditional media as far as education of TV, radio, newspapers, all those platforms are still very vital because everybody's not reading journals. Everybody's not reading long pieces of information. They want quick messages to get it out. And I reflect back to even in elementary school when we had Schoolhouse Rock. If you can remember, I'm just a bill, I'm only a bill, or conjunction, junction, one to function. That was years ago, and I still remember those ads. Yes, aging totally, but with age comes wisdom.
Yes.
So as we progress, we still need those little adages, those little tidbits of information to remind us where we have come from, but where we're going, and what we still need to do.
Oh, that is awesome. I love the way that you put it, right? we've done so much, but there's still so much to do, right? So prevention strategies, we're going to stick on this topic for a little bit, right? When we promote wider adoption of effective, promote wider adoption of effective HIV prevention methods. I'm going to throw it back to you, Dr. Francis, then you, Alex, and then Sally, I want you to round it out.
Okay, and I think that goes upon education still and awareness. Knowing your risk factors. There are risk factors that we can control and those that we cannot control. And the ones that we cannot control are age, right? We get older every year, whether we admit it or not. You know, there's certain types of health concerns that happen with age, and we need to, you know, promote our screenings, get out there, have conversations with the doctors. But then there are risk factors that we can control, and that's safer sex practices, how we educate ourselves, and how we choose to protect ourselves. There's a myriad of resources out there for protection, but do we still take advantage of that? You know, even when talking to students, they say, well, I asked for his health information, I asked for her health information, and this is what they showed me. But I said, well, did you ask the right questions? What about their past? Everybody has a past. Yesterday was a past. What we did yesterday reflects on what happens today and moving forward. But if you're not advocating and accessing the right information, you're missing the whole. So we still have to have these vital conversations.
Like this conversation. Absolutely. Alex?
It also has to do with sexual pleasure, right? Whatever your sexual pleasure is, right? Get tested periodically, right? Every 3 months. Use condoms, no matter if you're on PrEP, no matter if you're on Doxy, right? Condom is another way to protect yourself, right? For example, for women, Doxy would only be affected only 50%, right?
What's that one more time?
For Doxy. For women.
Say that loud.
For Doxy for women, it's only covered only 58%, right? For women. And then for substance use, the PrEP, it's only affected 74%. So it all depends your sexual pleasure and whatever pleasure you're using, you're engaging in to be able to be on PrEP.
That's a nugget right there. Sally, we'll throw it to you.
Yeah, actually, they took all of my stuff I was gonna say. So I think it's a common. What I want to drive the message is that this is not one size fits all. When we're talking about promotion, you have to use it like a toolbox. What we say in the community is like you get all the access is what you have in your toolbox. So yes, you should be talking about education and the fundamentals. Yes, you should be talking about sexual pleasure and also confidence and rebuilding in your sexual health. But I also think that consistency is really what we need now in the new space that we are in. You know, I think everyone knows or may not know, but with this new administration that's technically taking place going into January, it is so vital that not only do we stick to our fundamentals and talk about uplifting, but we have to consistently do that. We can't just wait until World AIDS Day. We should consistently talking about how it is important to uplift your health, because once you hit one, you're going to hit all. So thinking about your toolbox is something that you should just be using ongoing, because as I say all the time, like life be lifing. And so sometimes you need to pull from each different streams to get information to be able to promote. So I think the biggest thing in all of it is that staying consistent and our promotion and taking all different strategies to continue to uplift this so that folks know that it is a priority.
So Sally, you mentioned January 6th. Like, I'm doing this again, but we don't know what happened in not January 6th, January 20th. For instance, guys. But January, there's going to be a big transition that happens, right? We all know about it. What role, Sally, does policy change play in access to HIV prevention and treatment options, especially with the incoming administration?
So policy is everything. Without policy, nothing can take place, right? Because those are bills and laws that are in place to be able to prevent it. So if you're thinking about going to have access to get HIV treatment and care, and also testing. All of that is enrooted in policies that are in place. So optic out testing, HIV criminalization and stigma, discrimination, social determinants of health, all of those things are encompassing as the root of policy. So, what folks can really do in the community is one, start building relationships with not just policymakers and legislators, but they should be building relationships with the Department of Health. They should be building relationships with the CDC, even in your local, figuring out who works at your county, to building relationships with them, because they are the decision makers that are going to influence the folks who are in policy. And as they are either writing laws or they are uplifting and amending laws, it's so important that they're going to remember your face, remember your name, and remember the changes that you're wanting to make in the community surrounding HIV.
Yeah, so boots to ground, right? This is a guerrilla, like just like guerrilla warfare, like we're actually going out and doing the work. Because right now it's leaning on community to keep the work going, especially since we're kind of going into a full sense of security, right, with HIV transmission. So, Dr. Francis and Alex, I'll go to you first, Alex. What role can community-based organizations play in promoting HIV prevention and education?
I have no secret.
All right. So you want to start, Dr. Francis?
Oh, I can start. Community-based organizations. I'm going to dovetail a little bit off of what Sadie mentioned with the social determinants of health, where we live, work, and play. Because we're dealing with housing instability. You know, one of the biggest things in New Jersey is lack of housing. And even for the HIV/AIDS community, the stigmatism that surrounds that. Also with insurances, dealing with the uninsured and underinsured, having all those types of things that deal with the social determinants of health. But I think that we need to involve a lot of our stakeholders, and even as I did previous work with churches and community, because they also have a community arm, as they call it, CBC, a Community Development Corps. There was a program that was developed called Balm in Gilead that focused on advocacy specific for religious leaders to talk about HIV/AIDS in their congregation and go out into the community and educate others on that. Because we know all sorts of people go to church, all sorts of people go to houses of worship. So we want to meet them where they are and provide those resources as well as education. Tagging onto our political officials, being that squeaky wheel. We elected these officials to do a job. As people in the community, we want to see change, and change can be driven when we have that vote. Just went through a big election. Everybody's voice was heard. A lot of groups just emerged from that. So we want to keep that active and keep it in the forefront to drive those change, even with research and data and all those things that can impact grant writing and funding and developing communities to be better advocates.
Alex, I'm going to talk to you.
All right, so legislative change, right? Ensuring universal health care access. Like funding for housing, she said earlier. Also, expanding funding for prevention and treatment.
Stay on policy and advocacy, because at this point, we've learned, now we need to know how to do that, right? If that makes sense, right? So, Sadie, I'm going to toss it back to you because you're my state policymaker. How can advocates effectively engage with policymakers to address HIV-related issues at the local, state, and federal levels?
Well, so at the local level, one is finding out, and can be by looking up information. When I first started in the community, I knew nothing about politics. I had never got involved in any way, form, or fashion. I just started volunteering at various nonprofit organizations. And as I was volunteering at these places, I was starting to learn who were in decision makers, who were learning about different things that were happening at my local level. And then that opened up a door for me to start learning about who was representing me. So I think the first step is, if you are in your local area and you're wanting to do local work, is find out who represents you. Find out who your policy or decision maker that's in your district, your area, is finding out who represents you, and learn a little bit about their background of who they are. Don't even worry so much about the policy issues because that will overwhelm you, but just learn about the person and seeing if that person aligns with the things that are impactful to you. So, as me, because I am very committed to reproductive justice, I wanted to align with making sure that and in building a relationship with the person who represents me, learning about reproductive issues. If you are at the state level and you want to take it a step further, there's other certain ways to be able to get involved too. Is that social media is free, Google is free, and finding out and researching a little bit about the folks that are working at the state level in your community, in your area. I know that New Jersey is a little bit different than Texas, but the basis of it is still the same. It's finding out what's happening in the area, find out if there is local and state coalitions that are doing this work already, and figure out how to get plugged and involved. That's how you'll start showing up. That's how you will learn the policies as it come. Don't stress yourself so much on trying to figure out what this bill says or what this rule says. Just build relationship with the folks that are in the space at the table. So then when you're at the table too, you can also eat along with them. And if you want to take it a step further and you're wanting to go to a federal level, there's things of ours. So AIDS United does have a AIDS Watch, which is the national advocacy day that happens in DC every year. If you have the capacity and you would like to attend, that's a way for you to exercise your advocacy voice at the federal level. And if you aren't, there's AIDS Watch at home where you can do that in the privacy of your own state that's still pushing federal work. There's also ways to be able to get involved. The U.S. Caucus for People Living with HIV is a great organization and coalition that works on federal processes around it. But at the basis, no matter what level of work that you do, it's just important to be able to research. Watch your social media, watch CNN, watch your news, and figure out how not just HIV related issues, but things that are interconnected to HIV. So, housing, food insecurity, women's rights, reproductive work, all of those things that are so intersectional to HIV is so important for you to be able to get involved and learn and exercise your voice. And when you're in those spaces, you talk about the lives of people living with HIV so that that message does continue.
Well said. That was just a wealth of information. And quite honestly, between you, Alex, and Dr. Francis, I think we could carry this conversation another hour or so. But in the reality of things, we are running out of time. So I do want to acknowledge that we are doing the work in the community to end the HIV/AIDS epidemic here in America. But it is a global effort, right? And Delta Sigma Theta's Sorority Incorporated's international awareness and involvement sustainability plan is committed to doing it globally, right? So we have 7 international programs, but one that we want to focus on today is Delta House. And Delta House and Vashti Village in Bani Swazi, say that 10 times. It is a house that was dedicated in 2002 for orphans that lost their parents to HIV. So Delta Sigma Theta is committed to building out a village around their home. So that only happens with support, and that support comes from the community. It has been us, and it continues to be us. So this giving season, please help us reach our goal of $2,000 by March 31st, 2025. So that's next year, a couple months away, towards giving to the IAI sustainability plan, so that we can continue to support Delta House and continue to build Vashti Village. And our committee members are passing around the QR code. So you guys can scan that, and it will lead you to our page where you can support. And I do want to open the floor now to questions. So before I do that, there was one question that came over prior to the event from Maya Kane. And I think we've answered that, but I just want to put it out here just so that we can have one more go at it. Do you have any advice to our panelists for those wanting to advocate, against the stigma about HIV? So advice beyond what you said.
Okay, beyond what I said? Mm-hmm. Okay. Some of the advice that I would give to folks is to network. And network with like-minded groups. And Sally alluded to that a little bit about going with, joining coalitions and being a visible force, but also just networking with people to find out more, to research more, visit your local libraries, some of your community entities to educate yourself, because it's not just the infected population, it's the affected population too, because there's still caregivers, there's family members, there's all sorts of folks who are affected by this. People have lost jobs, people have lost housing, so just embody yourself within that community.
Absolutely, yeah. I do have a Facebook page and I have over 23K followers, and there we discuss HIV diagnosis, sex after diagnosis, and a lot of people join these channels and they have questions, right? And there's a lot of good information that's given in these channels. And the best thing is socialize with social media, formal outreach. I mean, speak to whoever is around with right.
Okay, now we do have some questions from the chat, so I want to extend to those viewers.
What type of education are middle school and high schools giving students?
Okay, Sally, Dr. Francis.
We do have harm reduction. I do have most of my prep counselors. They collaborate with the high school and the Hudson County Community College as well, and they do tabling there. They do testing events there, and they offer their services for testing and prepping about condoms. In Dickinson High School in Jersey City, and also the community college in Jersey City and Union City.
Some high schools are doing a lot of the peer leadership, where they go out into the community and talk to other students in schools about prevention, primary prevention, protecting themselves, risk factors, and what it means to be a young person who is also infected or affected with HIV/AIDS.
What are the stats on Black women who are HIV positive now as opposed to 20 years ago? Have the numbers increased in senior populations? What's being done?
Yes, I'll talk about, I'm going to address it from a gerontology aspect, because that is a missed population group, because a lot of people don't think, as we're talking about childbearing age and elementary age, but that population group is still increasing in infections, even STI infections, because of their status now. A lot of them are widowed, a lot of them are living independently, and they get lonely. And sometimes it's not a lot of men around, and it's so many females to one male, and infection starts. And they think because of their gynecological history of childbearing age is over. No, if you have vagina, there's always room for infections to come through. So it has increased within the last research, increased like 20% in senior buildings and nursing homes and assisted living conditions for our gerontology populations.
Alexander? All right.
So the last question that we have for right now, how can we help to make sure these programs are not cut in the next administration?
All right now,
Good question.
Alex.
So I will jump in to say that I know that it is scary about programs being cut. I do think that the way to be able to minimize the frustration and importance of it is, one, lobbying for legislative protections. So working with legislators to embed, making sure that HIV funding is basically like safeguarded, making them harder to dismantle, if that makes sense. And also just pushing for like dedicated funding. So that's why lobby and advocacy days at the state level are so important, because you can mitigate that at the state level as far as those federal cuts is concerning. I also believe in cross-sector movement. So as we know that I think there was a question in the chat that also talked about how Black women are obviously like overlooked in education and treatment. It's really promoting and building private and public partnerships. So if you work in a nonprofit organization, a community-based organization, it's securing funding and making sure that that is diversified from private entities and also federal funding. So if the federal funding does happen to get cut, you have something protecting involved. I think from a advocate standpoint, the only way that we're going to be able to minimize this or be able to safeguard ourselves if programs continue to be cut is fight against it by using our voices. So that's storytelling, humanizing the issue, talking more about stigma, involve trusted figures. Like I think that Dr. Francis talked about faith-based communities and involving church leaders, also community influencers that have HIV as a pillar to their work. Because oftentimes in coalitions based, we often forget that we have people already in our wheelhouse that are really important. So thinking about people who do substance abuse and harm reduction work, getting them as our allies to talk about HIV as an intersectional issue to their work is also a way that we're going to be able to focus on as advocates in the community, is changing the way that we talk about HIV. So making sure that HIV is a systemic issue, then that we are making sure that everything is encompassing into our HIV health. So like making sure that we talk about housing with HIV, we talk about food insecurity and HIV, we talk about abortion if we need to, and HIV. So adding HIV as an extension onto that because it's intersectional anyways.
Yeah, absolutely. And just honing in on what you said, just propping up and supporting new leaders, right? Through the storytelling and the advocacy, because they're the ones who got to take the charge, right? Do have some questions, y'all. If you see me looking over here, it's because we have an audience, and I do believe we have some questions in the audience.
It wasn't really a question, it was more like a comment. Hi, everyone.
Hi.
My name is Carol St. Clair. I'm an OBGYN and nurse practitioner. I'm an HIV educator for about the last 15 years or so. The one thing that I wanted to mention in this room today is that even as providers, we kind of have a barrier too, because what is missing for many of our patients is the ability to be honest and talk to us about what's actually happening. So that white coat syndrome is a real thing. Even when I don't wear my white coat, it's still like, oh, everything is good, I'm fine. So, we talk a lot about like we go into the room and there's no access and we want our patients to be able to talk to us, but we want our patients to be able to talk to us. So I also feel like in the community with the community-based organizations, we need some patient readiness, some patient advocacy training. How do you go into the room? How do you become comfortable with expressing yourself sexually to your provider? What makes you feel better? Because in our 15 to 20 minutes, 30 minutes, if we're good on time, we really do try our best to get information. But we also need patients to be able to talk to us. And so if we all can work together in talking to each other about what would make someone more comfortable, I also think that helps us too.
I love that, because that kind of brings us back to a circle of breaking the stigmas, right?
That's to do a lot with the
Having those
engagement,
conversations.
with the engagement with the person.
Yes.
Instead of reading from a paper, checking those boxes, looking at the person in the eye, and
Right.
actually speaking to that person, right?
Yes.
So it's a big difference because they look at that, right? They'll zoom in just, you want the person to zoom out the whole picture to be able to help them. Some people just zoom into one thing and not the whole thing. So the engagement is very important.
I think this was an awesome conversation. I hate that the time is running, but I definitely think that this opens the door to have more conversation. Because as you mentioned, Sally, this is not a just World AIDS Day conversation. This is a continuing conversation. This is an International Women's Day conversation. This is an HIV Awareness Day conversation. This is a conversation that needs to continue to happen, especially since this is going to fall into our lives for being the carriers and the ones responsible for educating our community. So on that note, I do want to close out a little bit. I want to say thank you to my committee members, because this program couldn't have happened without the committee members, and the Infotech committee for getting us out to the masses And I also want to thank my co-chair, Gail Ford, for just being extremely awesome, preparing an awesome panel. And just thank you again to our soror, Jessica True. This space is awesome. We're very excited for you and this space. So I just want to say thank you again. Very grateful to be allowed to use it. And now I will turn it over to our chapter president, Renee Belton, to give us some final words and close us out, if that's all right.
I just want to thank you, the panel, for coming out and educating us, along with the community. This is good stuff. And it's a continuous conversation. And I give you thanks on behalf of the entire chapter and the 3 communities that we serve as the councils we serve, as Chesapeake Community County. We really appreciate your time and your knowledge you instilled on us today. And hopefully we can help carry this torch and have it burn everywhere and not in this conversation. This could be the beginning of many conversations and actions. Okay. Thank you.
Thank you.